You're listening to Health Professional Radio. My name is Wayne Bucklar, and joining me today for Health Innovation is Dr. John Menzies. John is General Manager of the Health Roundtable Limited and joins us from Brisbane, Australia. John, I guess for a lot of health professionals who are working in hospitals and health services, they'd be familiar with the Health Roundtable, but for those listeners who are not familiar with it, can you tell us a little about the history of the Health Roundtable, what it does and how it assists hospitals with quality and with innovation and safety and efficiency?
Yeah, sure. The Health Roundtable actually started some 21 years ago in 1995 when a group of the chief executives of several hospitals around Australia and New Zealand thought that it would be beneficial if they could undertake clinical benchmarking of their services and start to look at what was different between the hospitals. So where a hospital was doing something innovative, certainly something different, that would improve patient care, safety, quality and efficiency, then the hospitals would look to share the improvements that they'd learned from their fellow hospitals. From that small beginning back in 1990, the Health Roundtable has grown substantially and now represents some 147 hospitals from around Australia and New Zealand in every state and territory and all of the district health boards in New Zealand. And it basically, as I mentioned earlier, undertakes clinical benchmarking on a regular basis and looks to understand what is different between hospitals and to understand that difference and then to look and see if the innovation or the difference is of value to other hospitals. And obviously it then shares that with its members throughout both Australia and New Zealand.
John, that's a big organisation with those sorts of numbers. There's still some room to grow, I imagine, but it sounds like that's pretty comprehensively covered the Australian health system.
It has. All the hospitals in New Zealand are involved. Not quite all the hospitals in Australia are involved, particularly the smaller country hospitals tend not to be members. But all of the major hospitals are members, and they're the ones where the health trends are usually set for Australian and New Zealand hospitals. And all of those hospitals regularly participate in the various activities that the Health Roundtable offers throughout each calendar year.
John, can you explain about innovation sharing and how the hospitals learn about innovation from one another?
Sure. Basically, there are four key ways. Firstly, we run workshops throughout the year, and they're usually on topics of interest that hospitals and their senior clinical staff have felt are important to look at in more depth. So it could be mental health, it could be medication, it could be obstetrics, it could be the surgical journey, it could be end-of-life care. And at each of these workshops, the participating hospitals will look at, firstly, their own data to see what is happening, where they are compared to one another. And secondly, they usually participate in sharing information from special surveys that we do. At those workshops, after they've seen how they're performing and what the differences are, hospitals present innovations or new ways of providing care to improve in the field that's being discussed, like, for instance, the surgical journey or end-of-life care. And those hospitals that have got the most interesting innovations, the other hospitals will ask questions and learn from them, and then hopefully go back to their own hospitals and implement the changes that they have seen and believe will work in their area. Obviously, every hospital in the world, not just here in Australia and New Zealand, but every hospital is on a different pathway in its journey to trying to improve quality and safety. And I must admit that I'm yet to see any hospital anywhere in the world that is absolutely perfect. Obviously, a number are substantially more advanced than others. So there's the opportunity for every hospital to learn, particularly in areas where they have a weakness. So the workshops is the most important way where we share the innovations. Secondly, we run specific workshops, which we run a few times each year, where we bring in experts from overseas. If we haven't cracked a particular problem in Australia or New Zealand, then we invite experts in the field from the United States or somewhere else in the Northern Hemisphere, or occasionally from South Africa, to present what they're doing differently to see whether in fact it can be of use in Australasian hospitals. Thirdly, all of our members have access to the Health Roundtable website, its publications and networks. Every workshop we run, we put on the website all the innovations that have been explained, some for the first time, others are just advancements on previous innovations. And every participating member has the opportunity to look at that at any time, to use the information to help improve their services. And finally, we have an annual innovation showcase where we literally share the best innovations with all the other members. That's in a special workshop, usually in Sydney or Melbourne. Plus, we also share the innovations as our client managers visit all of the different hospitals. So when they're visiting a hospital, if a hospital says, we're struggling with a particular area, we can share the innovations that we know we've heard about in the last couple of years that have been successful elsewhere, and we put the hospital in contact with the key individuals at other hospitals so that they can network and learn from the experiences elsewhere. So they're the four key ways how we share innovations between all our members.
That's a very extensive program, and one that I dare to suggest Health Roundtable could be very proud of. It sounds very comprehensive. You're listening to Health Professional Radio. My name is Wayne Bucklar, and I'm in conversation with Dr. John Menzies, the General Manager of the Health Roundtable Limited. John's been talking to us about the work of the Health Roundtable and the way in which innovations are shared amongst hospitals in Australia. John, does the Health Roundtable undertake work to inform its member hospitals about innovations that are occurring elsewhere in the world?
We certainly do. I touched on it briefly before when I said that we invite people from overseas. Many of our members, and including the staff of the Health Roundtable itself, are constantly looking at world literature and best performance in hospitals elsewhere, and also technological innovations. And if we see that something has emerged that could have particular value in an Australasian hospital, then we will look to bring that information back to one of our workshops, either through clinical information that we provide, or we will actually invite one of the inventors or the key performers of the innovation to Australia to actually run a workshop and share that information with the local hospitals and their staff.
John, fascinating to hear about the work of the Health Roundtable. If people want more information, I guess the website's the place to go?
It certainly is. It's just healthroundtable.org, and all the hospitals of Australasia who are members, of course, can access that at any time. One of the values of membership is that all of the subscribing member institutions, all of their staff have access, not just the senior clinical staff, but all of the staff have access. And if they're doing a particular research project or trying to improve a service element in their own hospital, it might only be a small department or an activity that's trying to improve services with local primary health networks in Australia or the primary health organisations in New Zealand, the individual staff members can actually go online themselves, find the information they need, and actually develop a program or an improvement that will help the flow of patients and their quality of care.
That website again was www.healthroundtable, all one word, healthroundtable.org. John, it's been a pleasure having you with me. Thank you for your time. I understand that you're a busy man, so I do appreciate your time with us today.
It's a pleasure.
You're listening to Health Professional Radio. If you've just joined us, then you've just missed my conversation with Dr. John Menzies, General Manager of the Health Roundtable Limited. But the good news is there's a transcript of our conversation and also an audio archive on SoundCloud and YouTube, and you can access all of those resources through the Health Professional Radio website at www.hpr.fm. My name is Wayne Bucklar. You're listening to Health Professional Radio.